Hello, everyone. Welcome to today's FB Live session to know your kidneys better. In current times, where the spread of virus brings restrictions on your physical hospital visits, would you believe that you can get consultation from 280 plus board certified expert doctors? Well, eGlobalDoctors has made that possible. Through their website and application platforms, eGlobalDoctors is currently providing medical consultation of 30 plus medical specialties. Register today or download the app so you don't have to worry about you or your loved one's health concerns. We have Dr. Girish Moore today with us from Arizona, USA. He graduated from Nephrology Fellowship from Nassau University Medical Center in 2008 and did the Critical Care Fellowship at Mayo Clinic. He was in practice at Critical Care Nephrologist for 6 years and then switched career to enter Transplant Fellowship at the University of Pittsburgh Medical Center. And he currently is practicing transplant nephrology at Mayo Clinic, Arizona. Welcome to the live, Dr. Girish.
Thank you very much, Arya. Appreciate it. Always glad to come back to the eGlobalDoctors platform.
Thank you. So starting with our first question, tell us about your background, clinical experience, and how you're associated with eGlobalDoctors.
So I'm originally from Mumbai, India, and I came to US way back in 2001, and I did all my training over here. I'm associated with eGlobalDoctors through COVID situation when COVID hit India hard last year. And I found the eGlobalDoctors platform and I volunteered some hours through this platform. And that's how I came to know about eGlobalDoctors.com. So that's where I am at.
Great. So starting with the kidney related questions. So for people coming from non-medical background like me, so they don't know what a nephrologist, the nephrologist term basically. So if you can explain what does a nephrologist do?
So a nephrologist looks at the medical aspects of the kidney disease. So we are basically involved in taking care of patients who have kidney disease. Kidneys are there. You get a couple of kidneys, each on one side. And they're primarily responsible for taking care of toxins, extra fluid, and you actually pee it out in the urine. And for some reason, if your kidneys are not working, you can have accumulation of this toxin and extra fluid. And there are different stages of kidney disease as you go through. And that's what my job is, to look at these patients, what medical conditions affects the kidney, as compared to urologist who looks at mainly the flow of what we call as a plumbing system from kidneys all the way to pee out, so the ureters, the bladder, the prostate. So that's what the urologist takes care of. We take care of medical aspects affecting the kidney.
Okay, yeah, that was actually a good clarification between the urologist and nephrologist job, because a lot of people do get confused about that.
Yeah, I think of a urologist as a plumbing job. So if there's something wrong with the plumbing system from the kidneys all the way to the outside, that's where urologist comes into play, along with cancers of the kidney also, actually.
Okay. So talking about the kidney, it's very common. We listen to people having kidney stones. So how common are these and why do they occur in some people and not in others?
So the occurrence or the prevalence of kidney stones are quite varied depending on country to country. In the United States, around, I would say 15 to 20% affects the males, around 10% the females. So a little bit higher in males as come to females, and the prevalence increases as you grow older. With regards to forming kidney stones, there's no single specific reason. It could be diet related. It could be how much fluid you take. It could be a tendency based on the genetic factors you bring into play, which can cause kidney stones. What we do know is that once you form a kidney stone, your risk of developing more kidney stones around 10 years is 50% risk of getting kidney stones again, actually. So it's very important that even with the first episode of kidney stone, you see a kidney doctor or even a urologist, actually, because some of the urologists specialize in kidney stones, and get a workup accordingly. Typically for the first episode, we don't do a whole lot of workup, but we do get basic testing and keep an eye. And if you form recurrent kidney stones, then you require more workup to risk how much fluid you're taking, look at the urine testing or 24-hour period, what factors in the urine is causing you to cause kidney stones. So it's multitude of factors, not a single factor per se. There's also distribution from a geographic point of view, be it United States or India, depending on how much water you drink, the hot, humid environment, sweating. It does play a role in that also. And there are certain genetic diseases. Obesity is linked to kidney stones, diabetes linked to kidney stones, sometimes hypertension may be linked to kidney stones. along with dietary factors, which can cause sometimes bowel disorders can also lead to kidney stones. So those workup is done by either a nephrologist and urologist, and sometimes they do it work together actually.
Oh, okay. Okay, great. So, how does a person would know if he has a kidney stone?
So most people will present with pain, or they have blood in the urine actually. So typically, a lot of people think about kidney stone as you're delivering a baby, a pregnant patient. It's so painful sometimes, you know. So most of the times they present with pain. The pain can last. The pain can go from your flank region just below the rib all the way to your groin region. Sometimes they have blood in the urine, but most of them present with pain actually more than anything else. And with the pain, you can get nausea, you can get vomiting. Every now and then we see kidney stones with infection. So you may have a kidney stone, you may not realize it may just be dull aching pain, and then you have infection, which causes fever, and you're present with fever and infection. That's a little bit more worrisome than a simple kidney stone.
Okay, so the pain and the fever would
Pain and the
clarify
blood in the
that.
urine. Fever is more
Right.
infection symptoms. It's a little late, but
Okay.
typically acute pain where the kidneys are just below the rib area actually, or back area, you know, or you have blood in the urine.
Okay. Right. So, what exactly is the major cause of the kidney failures that we hear about?
So typically, when I think about kidney diseases, the predominant cause across is going to be diabetes, hypertension. You know, those are the predominant causes of kidney disease in the United States and across the world. You have also have a genetic kidney disease like polycystic kidney disease, where the kidneys are replaced by cyst. Actually, that can be another cause. And the last thing, the four major cause, I think, of the fourth one is the glomerulonephritis, which actually affects the filtering segment of the kidney. So each kidney has millions of filtering segment. So I think of a sink basically. Like sink has those sieving, and that you drain all the water and all the big particles stay up in the sink. Suppose I make the holes bigger in that sink, things which are not supposed to go to the plumbing system will start going down the plumbing system. So same thing, glomerulonephritis is a condition. You start having holes in the filter of the kidney, and you start leaking things in the urine which is not good for you, like blood or proteins. So that's called glomerulonephritis. There are a lot of causes for causing glomerulonephritis. I typically think of four different causes: is diabetes, hypertension, polycystic kidney disease, glomerulonephritis. And sometimes there are urological conditions like obstruction causing with the kidney stone can also cause that particular problem, but those are predominant causes of kidney disease across the world.
Okay, so you just mentioned, is there any disease that is inherited also?
Yes, so polycystic kidney disease is one of the most common genetic disorders of the kidney, where the kidney is replaced by the cyst. You know, typically there are two different types. It's autosomal recessive, that means it can present in childhood, or dominant, which is more seen during your adult life. So that is one of the causes for causing kidney disease. And there are other genetic disorders of the kidney also, but predominant cause is polycystic kidney disease. It tends to run in families, but it doesn't have to. You may have negative family history and still have polycystic kidney disease based on genetic mutations.
Okay. So, what are the stages of these kidney diseases? How are they determined?
So there are 5 stages of kidney disease. It is determined by the blood test called creatinine. So creatinine comes from a muscle mass actually. It's a byproduct of muscle metabolism in a way, if you lack a better word. So basically each day muscles makes creatinine and the kidney dumps it out in the urine. Now, suppose something's wrong with the kidney, the creatinine goes up in the blood, and that's how we know something's wrong with the kidney. Okay, and also the second thing we look at is leakage of proteins in the urine. The protein is called albumin, or just protein you can call it, but albumin is what we look at. So based on how much the creatinine rise or how much protein you leak, there are 5 different stages of kidney disease. Stage 1 is a minimal disease, or minimal. Stage 1 is a basic disease, minimal disease, and stage 5 is basically pretty advanced disease, almost what we call is end-stage kidney disease. Most people require dialysis, but it depends on patient to patient. Some people can hold dialysis for some time before they can require dialysis. So typically stage 5 is called end-stage kidney disease.
So then, what are the treatment options for patients with the end-stage kidney diseases?
So before we come to end-stage kidney disease, our job as a nephrologist is first to see what we can do to see if there's any reversible cause for kidney disease. So if there is an obstruction, can you relieve the obstruction to the flow of urine, which may help the kidney disease? Okay. If there's diabetes, can we treat the diabetes better and hopefully stabilize the kidney disease and hopefully prevent the progression of kidney disease? Same thing for hypertension. There is good studies for polycystic kidney disease, also how we can prevent progression of polycystic kidney disease. However, unfortunately, there is a segment of population is going to progress. And these are typically patients who have uncontrolled medical issues, or they present pretty late. They did not know they had kidney disease. And if they result in end-stage kidney disease, there are three different options, or actually predominantly two different options. It's dialysis, where you are hooked up to a machine and the machine takes care of your basically that extra toxins and the extra volume of water and filters it out through the machine. Or you have transplantation, where you actually get a new kidney to help with the function of your own disease and hopefully have a better lifestyle and quantity of and quality of life. And there are different options in dialysis also, which I would not go into details right now.
Okay. So then what are the common non-specific symptoms that a person might want to look for the chronic kidney disease?
So that's a problem. So we don't have a specific thing which can, oh, this is from kidney disease, In general, most people will not feel anything till the kidney disease is pretty advanced. So stage 4 or so, an advanced stage 4 kidney disease, that's when most people start having symptoms. So you may have some symptoms of tiredness, fatigue, which is pretty non-specific. Your legs may start getting swelling. Your blood pressure may go up. You may have issues with sometimes your appetite may not be that great, So those are non-specific symptoms. As you grow through more and more towards end-stage kidney disease, you actually may become more short of breath. You just feel nauseous. You're more sleepy, more tired. Your hands may have what we call is asterixis, like you have flapping tremors, basically. So those are more delayed causes or delayed symptoms, basically. But most people do not have any specific symptom related to kidney disease. These are very non-specific. So the best way to know you have a kidney disease is through blood test. That's the best way to know it. And that's the only way we know you have a kidney problem, basically, through blood test. By the time the patient realizes something's wrong with the symptoms, it's too late, actually.
Okay. So you said stage 4 is the stage where the person can know.
A lot of times. You may have stage 3 also, where the patient may have some leg swelling going on, blood pressure may be uncontrolled. But typically stage 4, when they start having more leg swelling, problems with breathing, sometimes here and there, their blood pressure may be high, they may feel fatigue sooner than later. But again, these are very non-specific symptoms. Typically a kidney disease has to be pretty advanced to cause major issues.
But so is it possible that a person can have chronic kidney disease without any symptoms?
Yes, it can. So most cases of stage 1, stage 2, and stage 3, and all of some of the stage 4 kidney disease may not have any symptoms, actually. So a lot of times you pick up kidney disease, patient present to emergency room with symptoms, and we found their kidneys are no longer working. They end up on what we call as dialysis at that time. So especially young people, they have a very high threshold to having symptoms. So the compensatory mechanism is pretty good. So if you're young, 24-year-old, you may not have any symptoms. You may not even know about it till you present pretty late. So we see it quite commonly.
Okay. So then what does a patient need to do first thing if he discovers that he has a kidney disease?
So first of all, what I usually tell them is, let's make sure you really have a kidney disease. It's not a one thing, basically. So we tend to repeat the blood work again, depending on how bad the creatinine or kidney disease is. Actually, sometimes you don't require that. So we confirm that. And then typically you see a kidney doctor like me, a nephrologist, and they run battery of tests to see, is there a reason to have a kidney disease? So diabetes, hypertension, as I spoke before. B, what can we do for this kidney disease? Is there any reversible element for it? 3, sometimes you end up with a kidney biopsy where they go with the needle and take a small sample with the needle to find out what's actually causing a disease. Maybe there's treatment options available. And sometimes there's nothing, and we have to give them medications to control their blood pressure, sometimes medication to control the leakage of proteins, and hopefully stabilize the kidney disease at that time. But what is most important is continuous follow-up with the nephrologist with frequent intervals to see where we are at. Because as I said, the only way you know you have a kidney disease and you know that kidney disease is progressing is through blood work.
Right. So you are a critical care kidney transplant. So if you can briefly explain about what it is and the different types of it.
So I don't do critical care anymore. I used to do so at some point in my life, so I don't do that anymore. I'm purely a transplant nephrologist. So transplant is a modality of treatment for patients with end-stage kidney disease. So it doesn't replace your own kidneys in a way, you know, what your own kidneys does, because we only give one kidney actually when we do kidney transplant. So, and you have to take care of this transplant. Basically, what we give is rejection medicines to prevent rejection of the kidney. So, but transplant overall has shown that you have a better quality of life. So in terms of a lot of patients think about quality, they'll off dialysis, they have to be hooked up to a machine for whatever times a week they do dialysis. They're more independent, they can go where they want to go. And so freedom is there for that. They don't have to worry about arranging dialysis in advance if they go for a vacation. So it's a quality of life piece. And also dietary restrictions are usually, most of the patients are off, majority of patients are off diet restrictions with regards to kidney disease, okay? And second is quantity of life. In general, the survival with kidney transplant is better than survival on dialysis. So that's the reason transplant is a better option as compared to being on dialysis. Unfortunately, you have to wait to get a kidney transplant unless you have a living donor. So when we talk about transplant, there are two types of transplants we do. One is called living donor. That means somebody's alive and willing to give a kidney, and they go through a whole evaluation if they're living donor or not. If everything works out, most people can get a living donor transplant within 6 months, okay? And the second option is if you don't have a living donor, then you wait for somebody to die to get a kidney transplant. That's called cadaver kidney transplantation. India is upcoming at this time. India most likely does, most of the time they do living donor transplant, but the cadaveric transplant is upcoming in the last few years. In the United States, it's predominantly cadaver kidney transplantation, followed by living donor transplantation. So there are two options over there. Best option is obviously living donor transplant.
Okay. I think we can wrap this session with all the questions done. Thank you so much, Dr. Girish, for walking us through all the basics to all the major stuff about the kidney diseases. I hope it was of great help to everyone listening to us right now. Thank you so much.
And I'm happy to answer any questions they have for me. All right. Thank you very much, Arya. You take care.
Thank you so much.
Yep. Bye.